Section 2. Safety and Infection Control. In this section, we focus on one of the nurse's most important responsibilities, preventing harm before it happens. We'll cover standard precautions, transmission-based precautions, PPE, restraints, fire safety, electrical safety, poisoning response, incident reporting, seizure precautions, sharps safety, hand hygiene, and safe patient identification. These questions are high yield for the NCLEX because they test whether the nurse can recognize risk, choose the safest action, protect the client, and prevent infection or injury in real clinical situations. Question 9. Select all that apply. Contact precautions and PPE selection. Clinical scenario. The nurse is caring for a client with a healthcare-associated infection caused by methicillin-resistant Staphylococcus aureus, also called MRSA. The client is on contact precautions and has a colostomy. The nurse prepares to provide colostomy care. During the procedure, the nurse anticipates possible contact with stool and possible splashing of body fluids. And the question is asking, which personal protective equipment should the nurse obtain before providing colostomy care? Remember, this is SATA, so more than one option may be correct. The options are Option A, gloves. Option B, gown. Option C, goggles. Option D, surgical mask or face shield. Option E, shoe covers. Option F, N95 respirator. Take a moment and think about your answer. All right, let's break this down. The correct answers are Option A, gloves. Option B, gown. Option C, goggles. And Option D, surgical mask or face shield. The key idea here is that PPE depends on two things, the organism and the procedure. The organism is MRSA, which requires contact precautions. The procedure is colostomy care, which may involve stool and possible splashing of body fluids. So the nurse needs contact protection and splash protection. Now let's go through reasoning and logic behind each option. Option A, gloves. This is correct. Gloves are required for contact precautions and for any expected contact with stool, drainage, secretions, or contaminated surfaces. MRSA can spread through direct contact with the client or contaminated objects. Option B, gown. This is correct. A gown is required when direct contact with the client, colostomy appliance, stool, or contaminated linens is expected. Contact precautions commonly require gloves and gown. Option C, goggles. This is correct. Goggles protect the mucous membranes of the eyes. Because colostomy care can involve splashing of stool or body fluids, eye protection is needed. Option D, surgical mask or face shield. This is correct. A surgical mask or face shield protects the mouth, nose, and face from splashes. This is part of standard precautions when splashing of body fluids, secretions, or excretions is possible. Option E, shoe covers. This is incorrect. Shoe covers are not routinely required for contact precautions or standard colostomy care. They are used only in situations with heavy contamination risk, according to facility policy. Option F, N95 respirator. This is incorrect. An N95 respirator is used for airborne precautions, such as tuberculosis, measles, or varicella. MRSA requires contact precautions, not airborne precautions. Now here's the NCLEX alert. For NCLEX, remember that contact precautions usually require gloves and gown. Add eye and face protection if splashing is possible. MRSA is contact, not airborne, so do not choose an N95 respirator for routine MRSA care. Select only the PPE supported by the organism and the procedure. The key takeaway is this: PPE depends on both the organism and the procedure. MRSA means contact precautions. Colostomy care can create splash risk, so mucous membranes must be protected from body fluid exposure. Gloves, gown, goggles, and a surgical mask or face shield are appropriate here. but shoe covers are not routine PPE for standard colostomy care. Okay, let's move on to the next question. Question 10. NGN type matrix grid. Transmission-based precautions. Clinical scenario. The nurse is caring for 4 clients on a medical surgical unit. Client 1 is diagnosed with bacterial meningitis. Client 2 has suspected pulmonary tuberculosis. Client 3 has an MRSA wound infection with drainage. And Client 4 has influenza with coughing and fever. The nurse reviews the precautions needed for each client. And the question is asking, for each nursing action, identify whether the action is appropriate or requires intervention. This is a matrix grid question. You will look at each action and decide whether the precaution matches the client's infection and route of transmission. The nursing actions are: Option A. Place the client with bacterial meningitis in a private room or cohort with a client who has the same infection. Option B. Wear an N95 respirator before entering the room of a client with suspected pulmonary tuberculosis. Option C. Use gloves and gown when providing direct care to a client with draining MRSA wound infection. Option D. Place the client with suspected tuberculosis in a private negative pressure room. Option E. Instruct staff to wear a mask when transporting the client with meningitis outside the room. Option F. Wear a surgical mask when providing close care to the client with influenza. Option G. Use only standard precautions for the client with draining MRSA wound infection. Take a moment and think about your answer. All right, let's break this down. The correct answers are: Option A is appropriate, Option B is appropriate, Option C is appropriate, Option D is appropriate, Option E requires intervention, Option F is appropriate, and Option G requires intervention. The key idea here is to match the type of precaution to the route of transmission. Droplet infections need a surgical mask. Airborne infections need an N95 respirator and a negative pressure room. Contact infections need gloves and gown. Now let's go through each option. Option A says, place the client with bacterial meningitis in a private room or cohort with a client who has the same infection. This is appropriate. Bacterial meningitis is spread by respiratory droplets. A private room is preferred. If a private room is not available, cohorting with another client who has the same infection may be used according to facility policy. Option B says, wear an N95 respirator before entering the room of a client with suspected pulmonary tuberculosis. This is appropriate. Tuberculosis requires airborne precautions. The nurse should wear an N95 respirator or higher-level respiratory protection before entering the room. Option C says, use gloves and gown when providing direct care to a client with draining MRSA wound infection. This is appropriate. MRSA with wound drainage requires contact precautions. Gloves and gown help prevent transmission through direct contact with drainage, dressings, skin, linens, or contaminated surfaces. Option D says, place the client with suspected tuberculosis in a private negative pressure room. This is appropriate. Airborne infections require a private negative pressure room. This helps prevent infectious particles from spreading into the hallway or other care areas. Option E says, instruct staff to wear a mask when transporting the client with meningitis outside the room. This requires intervention. For droplet precautions, if transport is necessary, the client should wear a surgical mask when leaving the room. Staff use appropriate PPE during close care, but during transport, masking the client helps reduce droplet spread. Option F says, wear a surgical mask when providing close care to the client with influenza. This is appropriate. Influenza is spread by droplets. A surgical mask is used when the nurse is within close range of the client. Option G says, use only standard precautions for the client with draining MRSA wound infection. This requires intervention. Standard precautions apply to all clients, But draining MRSA requires additional contact precautions. Gloves and gown are needed for direct care. Now here is the NCLEX alert. For NCLEX, keep the routes straight. Meningitis and influenza mean droplet precautions. Tuberculosis means airborne precautions with an N95 respirator and a negative pressure room. MRSA wound drainage means contact precautions with gloves and gown. During transport for a droplet illness, the client wears the mask. Negative pressure rooms are for airborne infections, not droplet infections. The key takeaway is this: droplet precautions use a surgical mask. Airborne precautions use an N95 respirator with a negative pressure room. And contact precautions use gloves and gown. Private rooms or cohorting may be used for transmission-based precautions. Always match the PPE to the route of transmission. Okay, let's keep going. Question 11. NGN type highlight the text. Safe restraint application. Clinical scenario. The nurse obtains a prescription to apply soft wrist restraints to a confused client who is pulling at prescribed tubes. The nurse delegates the application of the restraints to an assistive personnel, or AP, and then observes the AP's actions. And the question is asking, highlight the action by the AP that requires further teaching. The observed AP actions are: the AP applies the restraint so that 2 fingers can fit between the restraint and the client's skin. The AP uses a quick-release safety knot on the restraint straps. The AP secures the restraint straps to the side rails of the bed. The AP applies restraint straps that do not tighten when the client pulls against them. Take a moment and think about your answer. All right, let's break this down. The correct statement to highlight is, the AP secures the restraint straps to the side rails of the bed. Now let's go through deduced logic behind each observed action. The first action says, the AP applies the restraint so that 2 fingers can fit between the restraint and the client's skin. This is a correct action. The restraint should be secure enough to prevent unsafe movement, but loose enough to avoid impaired circulation, skin injury, or nerve compression. The second action says, the AP uses a quick-release safety knot on the restraint straps. This is also correct. A quick-release knot, or an approved quick-release device, allows the restraint to be removed quickly in an emergency. The restraint should never be tied in a way that delays removal. The third action says, the AP secures the restraint straps to the side rails of the bed. This is the unsafe action. Restraints are attached to a stable part of the bed frame, never to the side rails. Side rails move up and down, so attaching restraints to them can cause the restraint to tighten or pull when the rail is lowered. The fourth action says, the AP applies restraint straps that do not tighten when the client pulls against them. This is a correct action. Restraints should not become tighter when the client moves or pulls. Tightening can impair circulation, damage skin, compress nerves, or cause injury. Now, here is the NCLEX alert. For NCLEX, remember that restraints are secured to the bed frame, never the side rails. Use a quick-release knot or an approved quick-release device. Check circulation, skin, and comfort after application. Restraints are used only when less restrictive measures are ineffective. And when the question says, requires further teaching, your job is to find the unsafe action. The key takeaway is this: restraints are a safety measure, not punishment or convenience. Attach restraints to a stable bed frame, leave enough space for circulation, and reassess the continued need for restraints regularly. Even when restraint care is delegated, the nurse remains responsible for safe application, monitoring, and follow-up. Okay, let's move on to the next one. Question 12. NGN type drop-down close, restraint monitoring and release. Clinical scenario. The nurse is caring for a confused client who has soft wrist restraints prescribed after repeatedly pulling at a newly placed nasogastric tube. The nurse delegates routine care tasks to the assistive personnel, or AP, but remains responsible for client assessment and safety. The nurse gives instructions about restraint care. and the question is asking you to complete each statement by choosing the correct option from the drop-down menu. You will decide the correct timing for restraint release, the correct activity when restraints are released, the correct assessment distal to the restraint, and the correct place to secure restraint straps. The first statement is, restraints should be released at least every dash. The second statement is, when restraints are released, the AP should assist with dash. The third statement is, the nurse should assess skin integrity and blank distal to the restraint. The fourth statement is, restraint straps should be secured to the dash. Take a moment and think about your answer. Consider all options, but pick the right one. Now let's go through the reasoning. First, restraints should be released at least every 2 hours, or according to facility policy. This allows movement, promotes circulation, and reduces the risk of skin breakdown, stiffness, injury, and emotional distress. Every 4 hours or every 6 hours would be too long. Leaving restraints in place too long increases the risk for impaired circulation, decreased mobility, pressure injury, and client distress. Second, when restraints are released, the AP should assist the client with range of motion exercises. Range of motion exercises help maintain joint mobility, muscle activity, and circulation while the client's movement is restricted. Medication administration would not be delegated to the AP. Documentation may be part of reporting routine care depending on policy, but the activity the AP assists with when restraints are released is range of motion. Third, the nurse should assess skin integrity and circulation distal to the restraint. Distal means farther away from the center of the body, below the restraint. The nurse should assess skin color, temperature, pulses, sensation, movement, and skin condition near and below the restraint. Tight restraints can impair blood flow, compress nerves, or damage skin. Appetite and bowel sounds may be important in other assessments, but they do not answer what must be assessed distal to the restraint. Fourth, restraint straps should be secured to the bed frame, not the side rails. This is a major safety point. If restraints are attached to the side rails and the rails are lowered, the restraint can tighten, pull the client, or place the client in an unsafe position. Restraints should never be attached to side rails or to a call light cord. Now, here is the NCLEX alert. For NCLEX, remember that restraints are released at least every 2 hours. Assess circulation and skin under and around the restraints. Attach restraints to the bed frame, never the side rails. The AP may assist with routine care, but the nurse is responsible for assessment and evaluation. And always use the least restrictive safety measure first. The key takeaway is this: restraints require frequent monitoring. Release restraints for range of motion and circulation. Check skin and neurovascular status. Follow facility policy and the provider prescription. Restraints should never be used for staff convenience, punishment, or routine control. Okay, let's move on to the next question. Question 13. Ordered response, fire safety, and race sequence. Clinical scenario. The nurse enters a client's room and sees smoke coming from a wastebasket. A small fire is visible in the wastebasket near the wall. The client is lying in bed and is awake. The nurse immediately assists the client out of the room. And the question is asking, place the nurse's next actions in the correct order. The actions are, extinguish the fire if it is safe to do so, activate the fire alarm, confine the fire by closing the room door, rescue the client from immediate danger. Take a moment and think about the correct sequence. All right, let's break this down. The correct order is 4, 2, 3, 1. So the sequence of action is rescue the client from immediate danger, activate the fire alarm, confine the fire by closing the room door, extinguish the fire if it is safe to do so. This follows the fire safety acronym RACE. R means rescue, A means alarm, C means confine, and E means extinguish, if safe. The first action is to rescue the client from immediate danger. Client safety comes first. Any client in immediate danger from smoke or fire should be moved to a safe location before anything else. The second action is to activate the fire alarm. After the client is safe, the nurse activates the alarm. This alerts staff and starts the facility's emergency response. The third action is to confine the fire by closing the room door. Closing the door helps contain smoke and fire, slows the spread, and protects other clients and staff. The fourth action is to extinguish the fire if it is safe to do so. The nurse may attempt to extinguish a small fire only after the client is rescued, the alarm is activated, and the fire is confined. The nurse should never place themselves at risk to fight a fire. Now here is the NCLEX alert. Fire response follows RACE. Rescue comes before alarm when a client is in immediate danger. Do not choose extinguish first unless rescue, alarm, and confinement have already been addressed. Close doors to confine smoke and fire. And remember, nurse safety matters. Do not fight a large or spreading fire. The key takeaway is this. R is rescue, A is alarm, C is confine, and E is extinguish if safe. Client safety comes before equipment, property, or trying to put out the fire. Okay, let's keep building clinical judgment and move on to Question 14, multiple choice, electrical safety with equipment. Clinical scenario. The nurse is preparing to start an IV infusion containing potassium chloride using an electronic infusion pump. When the nurse attempts to plug in the pump, all wall outlets near the client's bed are already in use. And the question is asking, which action should the nurse take? The options are, Option 1, start the IV infusion without using the infusion pump. Option 2, contact the electrical maintenance department or appropriate facility support for assistance. Option 3, plug the infusion pump into an available outlet located above the sink. Option 4, use a regular extension cord from the nurse's station to power the pump. Take a moment and think about your answer. All right, let's break this down. The correct answer is Option 2. Now, let's go through the reasoning. Option 1 says, start the IV infusion without using the infusion pump. This is incorrect. Potassium chloride must be administered carefully and at a controlled rate. Starting the infusion without a pump increases the risk for rapid infusion, medication error, and serious cardiac complications. Option 2 says, contact the electrical maintenance department or appropriate facility support for assistance. This is correct. This action uses the proper facility resource to solve an electrical safety problem. Medical equipment must be powered safely to prevent shock, fire, overload, or equipment malfunction. Option 3 says, plug the infusion pump into an available outlet located above the sink. This is incorrect. Electrical equipment should not be plugged in near water sources. A sink increases the risk for electrical shock, especially if water splashes or the cord becomes wet. Option 4 says, use a regular extension cord from the nurse's station to power the pump. This is incorrect. Regular extension cords are not safe for medical equipment. They can create fire hazards, tripping hazards, and overload risks. Hospital-approved equipment and facility support should be used instead. Now, here is the NCLEX alert. Never use unsafe shortcuts with electrical equipment. Avoid plugging equipment near sinks or water. Do not use regular extension cords for medical devices. Potassium chloride IV requires controlled infusion, usually by pump. When equipment setup is unsafe, use facility resources. The key takeaway is this. Electrical safety is part of client safety. Medical equipment must be properly grounded and safely powered. IV potassium is high risk and needs controlled administration. The safest answer often avoids improvising with equipment. Call the correct department when equipment or outlet safety is an issue. Okay, let's keep building clinical judgment and move on to the next question. Question 15. NGN type bow tie. Pediatric poisoning response. Clinical scenario. A nurse receives a phone call from a parent who says, "My 3-year-old swallowed some liquid furniture polish about 10 minutes ago." The parent reports that the child is awake, crying, and coughing occasionally, but is breathing without difficulty. The bottle label lists petroleum distillates as an ingredient. The parent asks, "Should I make my child throw up?" And the question is asking you to complete the bow tie by selecting 3 things. First, 1 priority nursing instruction. Second, 2 pieces of information the nurse should tell the parent to have ready. And third, 2 actions the parent should avoid. For the priority nursing instruction, the options are: Option A, induce vomiting immediately to remove the substance. Option B, call the Poison Control Center now for substance-specific instructions. Option C, give the child milk to dilute the furniture polish. Option D, drive the child to the emergency department without calling anyone first. For information to have ready, the options are: Option E, the exact product name and ingredients listed on the label. Option F, the child's usual bedtime routine. Option G, the estimated amount swallowed and time of ingestion. Option H, the parent's preferred pharmacy. For actions to avoid, the options are: Option 1, making the child vomit unless specifically instructed. Option J, keeping the product container available for reference. Option K, giving food, fluids, or home remedies unless instructed. Option L, watching the child's breathing while waiting for instructions. Take a moment and think about your answer. All right, let's break this down. For the priority nursing instruction, the correct answer is option B. Call the Poison Control Center now for substance-specific instructions. This is the priority because the child is currently awake and breathing without difficulty, so the situation is stable enough to call poison control first. Poisoning care depends on the exact substance, amount swallowed, time of ingestion, the child's age and weight, and the child's symptoms. Option A is unsafe because inducing vomiting can increase aspiration risk, especially with petroleum products. Option C is incorrect because the nurse should not recommend milk, food, fluids, or home remedies unless poison control gives that instruction. Option D is not the best first step because emergency care may be needed, but poison control gives immediate substance-specific guidance when the child is stable. For the information to have ready, the correct answers are option E and option G. The parent should have the exact product name and ingredients from the label, plus the estimated amount swallowed and the time of ingestion. These details help poison control determine the toxicity risk and next steps. The child's bedtime routine and the parent's preferred pharmacy are not priority information for immediate poisoning response. For the actions to avoid, the correct answers are option 1 and option K. The parent should avoid making the child vomit unless specifically instructed, and should avoid giving food, fluids, or home remedies unless instructed. These actions can worsen symptoms, increase aspiration risk, or delay correct care. Keeping the product container available is actually appropriate because poison control may need the label information. Watching the child's breathing is also appropriate while waiting for instructions. Now here is the NCLEX alert. Poison control is the priority if the child is currently stable. But if airway, breathing, or consciousness is compromised, activate emergency response. Never induce vomiting unless specifically instructed. The product label, amount swallowed, and time of ingestion are key cues. The key takeaway is this: poisoning care is substance-specific. Petroleum products increase aspiration risk. Avoid home remedies unless instructed. For a stable ingestion, call poison control first. For an unstable child, emergency response comes first. Okay, let's keep building clinical judgment and nursing insight. Question 16. Highlight the text. Factual incident and occurrence report documentation. Clinical scenario. The nurse hears a client call out for help from the room. When the nurse enters, the client is lying on the floor beside the bed. The bed alarm is sounding, and the client's walker is near the doorway. The nurse assesses the client, assists the client back to bed with help, notifies the healthcare provider, and completes an occurrence report according to facility policy. And the question is asking, highlight the statement that is most appropriate for the nurse to include in the occurrence report. The documentation options are: the client fell while trying to get out of bed without assistance, the client climbed over the side rail and landed on the floor, the client was found lying on the floor beside the bed at 06:45, the client became restless and refused to follow fall prevention instructions. Take a moment and think about your answer. The correct statement to highlight is: the client was found lying on the floor beside the bed at 06:45. All right, let's discuss the rationale behind. This is the best documentation because it is factual, objective, and based on what the nurse actually observed. The nurse knows the client was found on the floor beside the bed at 06:45. The nurse does not know exactly how the client got there unless the event was witnessed. The first option is incorrect because it assumes the client fell while trying to get out of bed without assistance. That may be possible, but it was not directly observed. The second option is incorrect because it assumes the client climbed over the side rail and landed on the floor. Again, unless the nurse witnessed that action, it should not be documented as fact. The third option is correct because it uses neutral, observable wording, found lying on the floor beside the bed at 06:45. The fourth option is incorrect because it uses judgmental and vague wording. Words like restless and refused should be avoided unless they are supported by specific behaviors or exact client statements. Now, here is the NCLEX alert. For NCLEX, document what was seen, heard, measured, or done. Do not document assumptions about how an event happened. Avoid blaming words like refused, non-compliant, careless, or restless unless they are supported by facts. Occurrence reports are completed according to facility policy, but they are not used to blame the client or staff. And in the medical record, do not write "incident report completed." The key takeaway is this: factual documentation protects the client and the nurse. Unwitnessed events require objective wording. Found on the floor is safer than fell out of bed. Document assessment findings and actions taken. Legal documentation should be specific, neutral, and observable. Okay, let's move on to the next. Question 17. Matrix grid. Sharp safety and needle stick prevention. Clinical scenario. The nurse is supervising a newly hired nurse and an assistive personnel during morning care on a medical surgical unit. Several clients require blood glucose checks, insulin administration, and blood specimen collection. The nurse evaluates whether infection control and sharp safety practices are being followed correctly. And the question is asking, for each action, identify whether the action is safe practice or requires intervention. The actions include activating a needle safety device after injection, recapping a used insulin needle, placing a used lancet into the sharps container, carrying an uncapped used needle across the room, wearing gloves during a fingerstick blood glucose check, pushing down items inside a sharps container, and responding to a needle stick injury. Take a moment and think about your answer. All right, let's break this down. The safe practices are: option A, activating the needle safety device immediately after administering an injection. Option C, placing a used lancet directly into the sharps container after a blood glucose check. Option E, wearing gloves when performing a fingerstick blood glucose check. And option G, washing the area and reporting the exposure after a needle stick injury. The actions that require intervention are: option B, recapping a used insulin needle before carrying it to the sharps container. Option D, carrying an uncapped used needle across the room to dispose of it after finishing documentation. And option F, pushing down on items inside a sharps container to make more room. Let's look at the rationales. For option A, the main safety rule here is simple. Used sharps should be handled as little as possible and disposed of immediately at the point of use. So, when the nurse activates the safety device right after an injection, that is safe practice. Safety-engineered devices are designed to reduce accidental needle stick injury, but they must be activated right away. For option B, recapping a used insulin needle requires intervention. Used needles should not be recapped because recapping creates a direct risk for needle stick injury. The needle should go directly into an approved sharps container. For option C, placing a used lancet directly into the sharps container is safe practice. Lancets are sharps, and they must be discarded in a puncture-resistant sharps container immediately after use. For option D, carrying an uncapped used needle across the room requires intervention. The nurse should not finish documentation first, and the nurse should not carry an exposed sharp around the room. Disposal should happen immediately at the point of use. Rationale for option E. Wearing gloves during a fingerstick blood glucose check is safe practice because blood exposure is expected. Gloves reduce contact with blood and body fluids, but remember, gloves do not prevent puncture injuries. For option F, pushing down on items inside a sharps container requires intervention. The nurse should never reach into, compress, or push down the contents of a sharps container. This creates a high risk for puncture injury. For option G, after a needle stick injury, washing the area and reporting the exposure is safe practice. The nurse should wash the area with soap and water, report the exposure, and follow the facility's post-exposure protocol. Now, here is the NCLEX alert. Do not recap used needles. Dispose of sharps immediately at the point of use. Never push down contents inside a sharps container. After a needle stick injury, wash the area, report the exposure, and follow the exposure protocol. Gloves reduce blood exposure, but they do not prevent needle punctures. The key takeaway is this: sharps safety prevents bloodborne pathogen exposure. Lancets, needles, and used injection devices go in sharps containers. Safety devices should be activated immediately after use. Sharps containers should not be overfilled or manually compressed. The nurse must intervene whenever unsafe sharps handling is observed. Okay, let's keep building clinical judgment and move on to the next.
Question 18. Matrix Grid. Patient Identification and Elopement Prevention. Clinical scenario. The nurse is caring for an older adult client admitted with a urinary tract infection. The client is intermittently confused, gets out of bed without calling, and has wandered toward the unit exit twice during the shift. The client is scheduled for morning medications and a diagnostic test. The nurse reviews safety actions with a newly hired nurse. And the question is asking, for each nursing action, identify whether the action is safe practice or requires intervention. The actions include verifying the client's full name and date of birth, identifying the client by room number, placing the call light within reach and activating the bed alarm, applying wrist restraints before trying other measures, notifying the charge nurse about elopement risk, confirming the identification band before transport, and giving vague instructions to the assistive personnel. Take a moment and think about your answer. All right, let's break this down. The safe practices are, option A, verifying the client's full name and date of birth before medication administration. Option C, placing the call light within reach and activating the bed alarm. Option E, notifying the charge nurse that the client is at risk for elopement and may need closer observation. And option F, confirming the client's identification band before sending the client for the diagnostic test. The actions that require intervention are, option B, identifying the client by room number before transport arrives. Option D, applying wrist restraints to prevent wandering without trying other safety measures first. And option G, telling the assistive personnel to just keep an eye on the client without explaining the elopement risk. Let's look at the rationales.
For option A, verifying the client's full name and date of birth is safe practice. The nurse should use at least 2 approved client identifiers before medications, procedures, treatments, specimens, and transport. Full name and date of birth are appropriate identifiers. For option B, identifying the client by room number requires intervention. Room number is not an acceptable client identifier. Clients can change rooms, beds, or units. Using a room number increases the risk for wrong client errors. For option C, placing the call light within reach and activating the bed alarm is safe practice. This supports fall prevention and elopement prevention. A confused client who gets out of bed without calling needs environmental safety measures and early warning systems. For option D, applying wrist restraints without trying other safety measures first requires intervention. Restraints are not the first intervention for wandering or elopement risk. The nurse should use the least restrictive measures first, such as reorientation, close observation, alarms, a safe environment, and team communication. For option E, notifying the charge nurse about elopement risk is safe practice. Elopement risk requires team communication. The charge nurse can help arrange closer monitoring, room placement near the nurse's station, frequent checks, or facility-approved elopement precautions. For option F, confirming the client's identification band before the diagnostic test is safe practice. Client identification must be verified before transport and procedures. The nurse should match the identification band with the order or transport request. For option G, telling the assistive personnel to just keep an eye on the client requires intervention. This instruction is too vague. Delegation requires clear communication. The AP should know that the client is confused, at risk for wandering, and must be reported immediately if attempting to leave the unit. Now here is the NCLEX alert. Use 2 identifiers, never the room number. Confirm identity before medications, procedures, specimens, and transport. Elopement risk requires team communication and prevention. Restraints are not first line for wandering, and vague delegation is unsafe. The key takeaway is this: wrong client errors are preventable safety events. Confusion, infection, and wandering increase elopement risk. Least restrictive safety measures come before restraints. Identification bands must match orders before procedures or transport. Safety plans must be communicated clearly to the team, including during shift report. Notify the charge nurse or provider and request closer observation or one-to-one supervision if the client is unsafe. Use facility-approved elopement precautions such as bed alarms, wander alert devices, exit alarms, or secured door systems. Okay, let's keep building good nursing practices and move on to the next one.